Today, we are talking about a procedure that can completely rejuvenate the appearance of the skin by making it look more youthful and awake. So a lot of people think that the only way to take away volume loss in the skin is traditional fillers. However, board-certified plastic surgeon Dr. Motykie is going to show us a more permanent fix to this problem today called facial fat transfer. What is facial fat grafting in the case that we're going to be focusing on today?
Well, facial fat grafting is basically taking a patient's own fat and using it to augment the face. You can use it to reshape the face or rejuvenate the face. And rather than using artificial fillers, we're able to use their own fat. And then on top of that, we're able to add stem cells back into that fat.
Who is the ideal candidate for this procedure?
There's actually a wide range of candidates for facial fat grafting, and it really depends on what we're trying to do. In a younger age group, it's a little bit more for facial reshaping, patients that want to have more of a cheek highlight, larger lips, jawline contouring. Whereas in older patients, it's more for facial rejuvenation or adding back facial fat that is lost or atrophied over time.
How does stem cells make a difference in the facial fat grafting?
Stem cells do a few different things in regards to augmenting the fat grafting. Because they're living tissue as well, their properties are very anti-inflammatory, so they help to speed healing and also shorten the recovery time. Secondarily, they're known to have an effect where they help to regrow blood vessels into the area, and that's really important for survival of the fat. So overall, you're going to see enhanced results as well as faster recovery. Facial fat grafting can be used to enhance any facial feature we want. A lot of patients are very familiar with augmenting the lips, but we can also use it to do anywhere in the face, from the brow to the temples, to the cheeks, to the under eyes, to the lips, to the nasolabial folds, to the jawline. So we can do the entire face or any one particular area of the face that patients are interested in. With all of my facial fat grafting procedures, I prefer to use general anesthesia at this point. The reason being the local use when patients are awake can kill the fat and the stem cells. So you're essentially putting non-viable fat into the face. So the first step is to achieve general anesthesia. The second step is to then harvest the fat from the patient. And I do that by hand using a syringe, a 10 cc syringe. The reason to do that, again, is that it's very gentle with the fat, so you don't damage the fat or the stem cells. The next step is then to take that fat and put it into a centrifuge to separate out the fat, stem cells, and the various layers that are inside that syringe. We then take that fat and we extract the actual fat cells, inject the stem cells back into the fat, and make it ready to inject into the face. The next step is then to put it into smaller syringes so that, again, we can use low pressure to inject into the face. And I use an approach intraorally or inside the mouth so that we don't have any scars on the face. We then gently inject that fat in small aliquots so that the fat has a chance to live and take. You want to spread it out throughout the face. You don't want to just put it a big lump in one place.
And how do you notice that this procedure changes your patient's confidence?
I think the effect of the fat grafting has a twofold. Initially, it's looking more attractive and younger, and they feel better about themselves as far as just being more photogenic and just in social situations being more confident. And then secondarily, because again it's living tissue, over time it actually helps rejuvenate the skin from inside out. So patients will notice that over time, not only do they look better, but that their skin looks better.